Hi everyone, today I'll go over Thrombotic Thrombocytopenic Purpura, also known as TTP. For some key background information, TTP is a deficiency of ADAMTS13, which would typically cleave the multimers of von Willebrand factor. For some pathophysiology, what happens is those multimers form chains and they chain the platelets together with them, which causes the clotting cascade to be activated, resulting in clots forming. Simultaneously, those platelets that get chained with the multimers result in a lower platelet count present in the bloodstream, which predisposes the individual to bleeding at other sites. The condition can be fatal if left untreated, and there's many different causes, but they include HIV, viral or bacterial infections, medications such as penicillin, clopidogrel, and cyclosporin, as well as lupus. For the clinical presentation, it is important to remember the terrible Pentad, which includes fever, purpura, changes in cerebral function, thrombocytopenia, and acute kidney injury. But how do you actually investigate for TTP? Firstly, you could perform a full blood count and use an EASE or urea and electrolytes, which would show you low hemoglobin with thrombocytopenia, and your UNEs would show you raised creatinine. You can perform a clotting screen, and that is typically normal with normal PT and APTT, and your peripheral blood smear would show microangiopathic blood film, so you would see red cell fragments on it, also known as schistocytes. Your urinalysis would show you proteinuria, which would also help show that the kidneys are involved. And in order to actually diagnose the condition, you would perform an ADAMTS13 activity assay and inhibition titration, and you would see a reduction in the activity of ADAMTS13. The management for acquired TTP includes plasma exchange, steroids, and folic acid, immunosuppression if the above doesn't work, or splenectomy if the response is not adequate with just immunosuppression or plasma exchange and steroids. In congenital TTP, all you need is a recombinant factor ADAMTS13, as that is what the patient is lacking, and replenishing it should stop the symptoms from occurring. That was a very brief overview of the condition. I hope you find it useful. I hope together with the videos on ITP and DIC, these three conditions are becoming a bit more easy to understand. But if you have any questions, feel free to leave them down in the comments. Thank you so much for watching, and I hope you consider subscribing.